Welcome to the quick guide on how to use your Saxenda pen. The Saxenda pen quick guide is based on the instructions for use in the Saxenda patient information leaflet. For full information on how to use the Saxenda pen, please see the instructions for use in the patient information leaflet that comes with the Saxenda pen. Step 1. Check the Saxenda pen. Check the name and the coloured label of your pen to make sure that it contains Saxenda. Check that Saxenda in the pen is clear and colourless. Step 2. Attach a new needle. Take a new needle and pull off the paper tab. Push the needle straight onto the pen and turn until it's tight. Then pull off both needle caps. Keep the outer needle cap. You'll need it after the injection to safely remove the needle from the pen. Step 3. Check the Saxenda flow. Check the Saxenda flow before the first injection with each new pen. Turn the dose selector to select the flow check symbol. Hold the pen with the needle pointing up. Then press and hold the dose button until the dose counter returns to 0. Make sure that a drop of Saxenda appears at the needle tip. If no drop appears, repeat this step up to 6 times. If there's still no drop, change the needle and repeat this step once more. Step 4. Select the dose. Turn the dose selector to select the dose you need to inject. Step 5. Inject the dose. Make sure you can see the dose counter. Insert the needle into the skin. Press and hold the dose button until the dose counter shows 0. The 0 must line up with the dose pointer. Keep the needle in the skin and count slowly to 6 to make sure the full dose is delivered. 1, 2, 3, 4, 5, 6. Then remove the needle from the skin. Step 6. Remove the needle. After the injection, carefully slip the needle into the outer needle cap. Once the needle is covered, carefully push the outer needle cap completely on. Unscrew the needle and dispose of it carefully. Put the pen cap back on. You've now learned how to complete an injection with the Saxenda pen.